Right now, somewhere in your house, there's a small orange bottle that could be quietly rewriting your brain's future. Not a street drug. Not something illegal. Something your own doctor handed you with a smile and a "take one of these daily." I'm Dr. Sara, and today I'm going to tell you about 9 medications, some of them sitting in almost every American medicine cabinet, that research has connected to a higher risk of dementia. Stay with me until the end, because number 4 is the one most people are shocked to hear about, and I'm also going to give you the exact script to use with your own doctor so you can protect your brain without putting your health at risk. Let's get into it. Let's start with something almost everyone has reached for at some point, an allergy pill or a sleep aid containing diphenhydramine, the active ingredient in Benadryl. It feels harmless. It's sold over the counter. Your grandmother probably takes it every night to fall asleep. But here's what most people don't know. Diphenhydramine belongs to a class of drugs called anticholinergics, and these drugs block a brain chemical called acetylcholine that your memory and learning systems depend on almost entirely. Multiple long-term studies following older adults for years found that people who used anticholinergic medications heavily and repeatedly had a meaningfully higher risk of developing dementia later on. One dose isn't the danger here. It's the person who's been popping these every single night for a decade without ever questioning it. Now let's talk about something a little more sensitive, the anti-anxiety and sleep medications known as benzodiazepines. Xanax, Valium, Ativan. These drugs work fast, and for people in the middle of a panic attack or a sleepless spiral, that speed feels like a miracle. But researchers have raised real concerns about what happens when these medications become a daily habit that stretches into years rather than weeks. Long-term, high-dose use has been associated with cognitive decline in multiple studies. I want to be very clear here. This is not about the person who takes half a milligram before a flight once a year. This is about long-term daily dependence, and if that describes you or someone you love, this is worth a real conversation with your prescriber, not a sudden stop, because withdrawal from these medications can be dangerous. Here's one that surprises almost everyone, because it seems completely unrelated to your brain. Acid reflux medication. Proton pump inhibitors like omeprazole are some of the most prescribed drugs in America, and millions of people take them every single morning without a second thought, often for years, sometimes for decades. But here's the connection: researchers have been investigating long-term PPI use has been linked in observational studies to reduced absorption of vitamin B12, a nutrient your brain absolutely cannot function without. Some of those same studies have found an association between years of PPI use and increased dementia risk. If you've been on one of these for longer than the label recommends, this is a conversation worth having. And now, the one I promised you, the twist almost nobody sees coming. Statins. The cholesterol drugs taken by tens of millions of Americans every single day. For years, there were scattered reports and internet rumors that statins caused brain fog and memory problems, and that fear spread fast because heart medication touching your brain sounds terrifying. But here's what the more recent and much larger studies have actually found. For most people, statins do not appear to raise dementia risk, and in some populations, they may even be protective. I'm telling you this not to alarm you, but to show you something important. Headlines move faster than science, and the medication your neighbor swore off on Facebook might be the exact one keeping your arteries, and by extension, your brain's blood supply, healthy. always check the actual research, not the rumor. Moving on to chronic pain, because this affects an enormous number of people quietly living with conditions nobody can see. Long-term opioid use for chronic pain has been associated in research with structural and functional changes in areas of the brain tied to memory and processing speed. If you or someone you love has been managing pain with these medications for years, this isn't about shame or judgment. Chronic pain is real, and it deserves real treatment. It's about making sure the conversation about long-term brain effects is part of your ongoing care plan, not something nobody ever brings up until it's too late. Next, a category that quietly overlaps with a condition many people don't even connect to memory: seizure medications, also called anticonvulsants. These drugs are frequently prescribed not just for epilepsy, but off-label for nerve pain and migraines. In older adults especially, long-term use has been associated with cognitive slowing in several studies. If you're on one of these for a non-seizure reason, it's worth asking your doctor whether the dose or the drug itself could be adjusted. Here's a subtle one that a lot of people miss completely: older generation antidepressants like amitriptyline, known as tricyclic antidepressants. These are different from the newer SSRIs most people picture when they think antidepressant. Tricyclics carry anticholinergic properties similar to that allergy medication we talked about earlier, meaning they interfere with the same acetylcholine pathway your memory depends on. The good news is that most newer antidepressants don't carry the same concern, which is exactly why this is a conversation worth having with your prescriber if you've been on an older generation medication for years. Now, something incredibly common among older adults, especially women: overactive bladder medications like oxybutynin. These are anticholinergic too, and here's what makes this particularly concerning. They're most often prescribed to the exact population that's already more vulnerable to cognitive decline in the first place: older adults. Several research teams have specifically flagged this combination as one worth watching closely, and it's one of the most overlooked items on this entire list because nobody thinks of a bladder medication as a brain medication. And finally, number 9, antipsychotic medications used in elderly patients, particularly when prescribed off-label to manage behavioral symptoms in people who already have dementia. The FDA has issued specific warnings about increased risks, including cognitive and mortality concerns, in this exact scenario. If you have a parent or loved one in this situation, this is one of the most important conversations you can have with their care team. So here's what I want you to actually do with everything I just told you. Do not stop any of these medications on your own. I want to say that as clearly as I possibly can. Suddenly stopping benzodiazepines, seizure medications, or antidepressants can be medically dangerous, and some of the conditions these drugs treat are far riskier left untreated than the medication itself. What I am giving you instead is a script. The next time you're at your doctor's office, ask this: is this medication on the anticholinergic risk list? Is there a lower risk alternative available for my specific situation? How long have I actually been taking this, and is it time to reassess? And what's the shortest effective course of treatment for what I'm dealing with? For questions. That's it. Bring a notepad, write them down, and don't leave the appointment until you get real answers. Your brain is the one organ you cannot replace, upgrade, or get a second opinion from later once the damage is done. The medications on this list aren't villains. Most of them are genuinely helpful, sometimes life-saving, and the goal was never to scare you away from your prescriptions. The goal is to make sure you're taking them with full information instead of blind trust. If this video changed how you'll walk into your next doctor's appointment, that's exactly what it was made for. Subscribe to Ask Dr. Sara, because next week I'm breaking down the foods researchers believe may actually help protect your brain starting today. I'll see you in the next one. This video is for educational purposes only and is not a substitute for professional medical advice. Always consult your doctor before making any changes to your medication, but for a while just think before taking these drugs.